Hello beautiful people, welcome back to my channel. My name is Victoria Iwuji, BSN RN. As you all know, if this is your first time joining this YouTube family, please go ahead and hit on the subscribe button below, share with your friends, like, put down your comments. If this is not your first time coming back, thank you so much for your support. Thank you for showing me love. I truly appreciate it. Thank you so much. Today's video is about what's on your nursing clinical bag. Okay, as a nursing student, a night before your clinical, if you're getting ready for your clinical, there's one thing that you must never ever forget when you're going for your clinical. That's your stethoscope. If you leave this home, you're not ready for that day, because you're gonna do your assessments with this. You're gonna listen for the long sound. You're gonna listen for the. You're gonna listen to the heart sound. You're gonna listen to the bowel sounds. There's no way you're gonna complete your head-to-toe assessment as a nursing student without your stethoscope. But this is a must-have for your clinical days. Never ever forget this. Another thing that you don't wanna forget is your pen light. This, okay, pen light. You need your pen light for neuro assessment. Another thing that you need in your clinical bag is your watch with a second hand. Okay? You need a watch with a second hand. I have Apple, not this watch, you know. You need a watch with a second hand. I have Apple Watch, but second hand, okay? For your clinical. You need a nursing clipboard. It will teach you a lot, you see? You have your injection sites, everything, you know, there. You have your signs and you have symptoms of sepsis at the back over there. So you need nursing clipboard. You need this to put your paper, your plan of care, everything that you're going to be submitting to your instructor. You need to put them in there. They don't want coffee spilling on your homework. You don't want tea spilling on your paper. You just need to put them in here straight and you fold it. It's gonna stay safe until the time you're gonna submit it to your professor. Okay, so you need a small notebook with a black pen. In nursing we use black pen. Okay, so practice writing with a black pen or pencil. Okay, when you go for your clinical, you need a black pen. You need a little paper that can fit into your nursing uniform pocket. This paper, you need to use it to write medications. Any medication that you hear in the clinical or that you gave with the supervision of your instructor, you write it down when you get home. You go to your nursing medication book and you look for the name of this medication. What is it for? You look for the generic name. You look for the trade name. You know, the pharmacological action. You look for the contraindication. Everything about those medications, you write it down, and it's gonna help you a lot. Yes, I know that for my first clinical experience, the first medication that I was able to hear in the clinical was Keppra. Okay, and until today, I can never forget that Keppra is a seizure medication, because I had that medication in the clinical and I came back home, I looked it up, and the day that I was taking quiz in class and this medication came out, I was so excited. It helps me, like, it gave me that encouragement to do more. Okay, because just because of that one medication that I did practice in the clinical and it came up in the school during my quizzes, I was so excited for that. So it's always good to have a little paper, write down things, look it up when you get home. Okay? Okay. Another thing you need in your clinical bag is your location ID, and make it visible. Most of the facilities that I know, if you don't have the ID, you can't go in. Okay, this is for the safety of the patients. If they don't know who you are, you cannot go in without your ID. So proper uniform include your ID, and it must be visible. Okay, it must be visible above, over here, not below. So that's how to put your ID. And you need to go with a small bag. Most clinical locations don't have a locker for nursing students. They have locker for their staff, but they don't have locker for you. So make sure that you have a little bag, a small bag that can just fit in your snack and your little lunch. Don't come with big luggage. You're not gonna find nowhere to put your luggage, I'm telling you. Okay, you're not gonna find nowhere to put it. Just come with something small. And you need to bring hand lotion. Is a lot of hand washing in nursing. Is a lot of hand washing. So you need hand lotion if your hand dry up so easily. So you need little hand lotion that you're gonna put on your hand each time you wash your hair. Okay, and you need proper uniform. Even if you happen to be so lucky, okay, which is rare, I haven't really seen it, but if you happen to be lucky and you are a CNA already before you start nursing school, or you're a PCT already before you start nursing school, or you're a PCA, or you are a tech in the hospital, okay, before you start nursing school, and you happen to be so lucky, your school send you to your facility for clinicals, please, when you're going for your clinical, do not appear with your PCA uniform. Do not appear with your tech uniform. You have to go to clinical with a proper school uniform, because at that time you're not representing your job, you're representing your school. And for my ladies out there, if your school happen to have white uniform, you know, white top, white bottom, please, when you go for clinical, it's not good to wear pink panties, pink bra, purple bra, orange panty under a white uniform. Oh my God, that's just gonna be like a map, okay? You're gonna walk and everyone's attention is on you because you're revealing your body. That's not appropriate at all. And I know if your clinical instructor see you with that, they're gonna speak to you about it. Please don't make that mistake. Leave your colored underwears for other uniforms, not white. Okay, you're not just like embarrassing yourself when you dress up like that, you're embarrassing your faculty also. So don't dress up like that, please. That's not good. So go with your water, go with snack. Hospital foods can be pricey, so as a nursing student that don't have that much, you know, money, go with your own food. Okay, pack up some snack. You're gonna be working as a nurse alongside with your instructor. And if you ask nurses, sometimes you don't have time for your break. So it's really important that you pack up some snack. This is gonna help you, okay? When you're going for your clinical, plan for these things, and good luck with everything. Thank you so much for watching my video. This is my little video for you guys. Thank you so much. I see you in my next video. Bye.